All right, Senator Barrow, is she? Welcome to Health and Welfare.
Man, I missed you guys.
We miss you too. All right, you've got Senate Bill 41. You want to tell us what it is and why we need it?
Yes. Good morning, everyone, and thank you so very much for allowing me to be back in committee. I definitely miss Health and Welfare. This is one of my favorite committees. But I am here bringing Senate Bill 41 as a result of a resolution that I actually introduced last session. And we have spent a lot of time looking at child welfare, child abuse cases, and how those cases are actually filed and who's responsible for them. So Senate Bill 41 actually started off addressing that issue, and then we kind of ended up finding out that there was a gap as it related to licensure for early learning centers. And so this bill addresses the child welfare issue as it relates to abuse and neglect, who's responsible for reporting. We attempt to address that issue. I have to tell you that I'm going to do or continue the resolution because we did not get everything that we attempted to address actually settled before the start of session. And because it is a very lofty matter, we are going to take this issue or continue this resolution going forward. But these are some small steps that we are taking. So the bill attempts to do a couple of things. A is actually addressing the loophole that we had as it related to unlicensed early learning centers, as I stated before. Then secondly, it addresses to some degree, who will be responsible, and we kind of clarified the language, current language, as it relates to caretaker in current law, what that means, what it should mean, who will specify, so we would have a starting point. And then we are addressing as well a term that came up as it relates to valid or invalid, to changing that to substantiated to unsubstantiated, because oftentimes if a case was deemed to be invalid, it made it seem like it had no merits, and that was not necessarily the case. And so those are the big buckets of what the bill does. I know that there are a set of amendments. We have worked tirelessly with the departments to work on something that is doable, something that reaches the goal in terms of ensuring that our children are safe. And as I stated, we are not all the way to the finish line, but this is an attempt to begin to make those baby steps to address those issues. And I know that we have the testimony of the family that through this process we learned that the early learning centers had some gaps as it related to licensure. But I guess we take up the amendments first.
We can do that. Is going to put the bill in its proper posture?
Yes.
Okay. You want to pass those amendments out, and then we'll either you or we'll have staff explain. Here, Mr. Trapp, you want to explain what the amendments do? There you go.
All right, so the amendments look lengthy, but a lot of them are technical and just kind of making the same change over and over throughout the bill. So page 1 is mostly technical changes. It's also changing some of the language regarding the registry at the request of DCFS. We had that a person's name was placed on the registry, but they would like it to say that they were recorded on the registry. So that change is reflected throughout. It's also for school employees that are going to be required to have a registry check before they can be hired. The checks are only going to apply to those that appeared on the registry after August 1st, 2018, because that's when DCFS changed their appeals process. And when they did that, they did not go back and notify people of their appeal rights. And so they would be waiting until the person was applying to get hired at a school and then notify them of their appeal rights, which could push back people being able to get hired for about 3 months. So to eliminate all of that, we're just saying if you're on the registry after August 1st, 2018, that's when all of this applies. We are also removing the registry checks for teacher certifications because they're already having to get checked for by the school for the background check. So to prevent them from having to get checked twice, we're just removing that component. Page 2 is just doing the same things again. It's also requiring that only new school employees are the ones that are going to be checked on the registry to, again, help DCFS and DOE from having to go back and check every current school employee. On page 3, some of the substantive amendments are amendment number 28 is removing a requirement that DOE has to post the names of the people who applied who have a criminal background or appear on the registry, because there were some concerns about cost and privacy. Amendment number 35 is removing the change to the definition of neglect. Amendment number 36, that is making changes to the, 36 and 37 are making changes to the child abuse cases that are going to be reported to DCFS. 38 is making changes to the law enforcement cases reported to law enforcement. On page 4, 39 is adding some clarifying languages about who's responsible for which type of cases. And really, the rest of it is technical until you get to, 47 is exempting out school employees from having to pay a $25 fee to get the registry check. And then 48 is implementation timelines to let everybody get their systems updated and get employees hired. That's the amendment.
Thank you, Ms. Trapp. Does the committee, are there any questions on this amendment set? They're lengthy. But no, seeing no questions, I'll offer up amendment set 428. Are there any objections? Seeing none, those amendments have been adopted. Senator Barrow, do you want to start off with the video testimony?
Yes.
Okay, and then we'll go into a little bit
The merits of the bill. Yes.
Okay. We can go ahead and get that queued up.
Oh. Oh, you want me to hit it?
All right, good morning, esteemed members of the committee. My name is Major Roger Williams, and I'm an active duty member of the Louisiana Army National Guard. This is my wife, Dr. Regina Padre. She's a nurse anesthesiologist at a large teaching facility in New Orleans. Dr. Stanley, I believe she actually took you as one of the electives, which actually helped us in our initial step to be on the right path, so we appreciate you and the work that you do. She has her doctorate in nursing practice. Together, we have two amazing little girls that are our absolute world. Today, however, I'm not here as a soldier. I'm here as a father and an anguished father who's fighting for change on behalf of my now 4-year-old daughter. On the day I'll never forget, I picked my daughter up from school. I took her straight to gymnastics, our normal Monday afternoon routine. When I helped her change into her leotard, I discovered a significant amount of blood in her underwear. Alarmed, I took a picture and I sent it to my wife to confirm if this was normal. Her response was immediate and clear. This was not normal. We gently asked our daughter what happened. She told us a boy in her class had hurt her by touching her inner vagina. She also mentioned that an assistant teacher witnessed the incident and told the boy to stop touching her private. But no further action was taken. Devastated, we immediately sought medical help at Children's Hospital in New Orleans. Sitting there trying to explain to my daughter that she had done nothing wrong was one of the most heartbreaking moments of my life. In the weeks that followed, my mental health would be equivalent to, if not worse, than my combat deployment to Iraq.
Here is felt like a system failed us. So I've been sitting here attentively listening to everyone give their discussions of how they're preventing this, but I can tell you as a consumer how it's been for us, okay, as parents. So after her assault, we turned to these very systems designed to protect our children, right, our most prized possession in life. And so we went to JPSO. Well, immediately we contacted the school, okay. From there we contacted Jefferson Parish Sheriff's Department. And they initially refused to investigate. They didn't want to do anything about it. They said the boy was the same age, nothing's wrong. So nobody got in touch with us from JPSO. So from there, we turned to DCFS. DCFS said, JPSO said turn to DCFS and the school for any actions to be taken. So then we turned to DCFS, and it was declared that the law enforcement had that issue and that we need to go back to JPSO. And they continued to resist involvement, and they cited that the children's age is a barrier, as in
Detective, so because they're under the age of...
what happened. It's circling here.
I don't think that was the full extent of the video, was it?
No, it wasn't. It's circling here. I can't help y'all with any of that.
Oh, it's buffering.
It was buffering.
Turn it back on.
Involvement, and they cited that the children's age is a barrier, as in,
Detective, so because they're under the age of 10, to our understanding, there's nobody to charge legally. So we were never, we asked multiple times to be given to the SVU unit. We weren't. We got, after many phone calls over a few weeks, we finally got assigned a detective from the school resource department.
but when we went to the Audrey Hepburn Center, JPSO didn't show up. We called them, we requested them to appear. They didn't come. Nobody from JPSO came. So we were sitting there without any law enforcement at the Child Advocacy Center. So from there, like we said, I notified the school. They would not meet with us for 7 days. The caveat to this situation is that our children, us being from New Orleans, went to private school. So we'll go further into it, but there's not as much oversight because it is a private school. And there are some very large loopholes that we have discovered the more that we've gone down this rabbit hole trying to find answers for our child. So they met with us 7 days after their investigation, and they admittedly, the two administrators responsible for the investigation are untrained and have never dealt with this before at their school. Okay, so we were told that these were serious allegations and that they were not found to be credible. Okay, the footage that they reviewed were cameras outside of the school. They have no cameras within the school to review it. Okay, so we asked, did you notify the boy's family? Because, like everyone's agreed here, we want to make sure that that child is safe as well, because it's typically a learned behavior. And they said that they refused to tell his family because it would be devastating if it wasn't true. Anyways, the most egregious thing, how we feel afterwards as consumers, is by the Department of Education. So, according to their interpretation of Bulletin 137, schools like the one that my daughter attended, which was private school, has a loophole that if children that turn 3 by September 30th, they're not actually required to be licensed. So you can have a private school that goes from 10 weeks through middle school. And if they're 2 and unders, they can be licensed. However, starting at 3, they can be unlicensed. And if they're unlicensed, then they don't have to follow the Department of Education's guidelines.
The Department of Education, when we contacted them, they stated that because they are not required to have a license, that they don't have jurisdiction, and that they can't cite the school, that they won't do an investigation. So the follow-up question was, who does have jurisdiction? No one's been able to tell me who has jurisdiction.
So how is that acceptable, ultimately? How can a school that takes care of vulnerable children, right, preschool, my daughter was 3, how is no one held responsible? Nobody's accountable. Everybody's pointing fingers at each other. JPSO points to DCFS points to the school, law enforcement. Then we go to the Department of Education. They won't do anything. The school's never been cited. The boy never missed 1 day of school. I immediately pulled my daughter out. We had to fly my father-in-law down from New York City to watch my kids. And they couldn't go to school until we found a new school almost half a year later.
All right, Senator Barrow. So what we're dealing with here is there's clearly, based on the testimony that we just saw, that there's a clear gap in child-on-child sexual abuse cases.
Yes.
between DCFS, Department of Education, law enforcement, schools. And so what you're trying to do here is address that.
Yes, so that's one aspect of this bill that it certainly attempts to address as it relates to ensuring that that doesn't happen. Also, licensure, because we found out that those privately owned facilities do not have to have the same criteria. They don't meet the same criteria. They don't have to. So trying to make sure that they all do, and then creating the registry. So that we can actually be able to check and make sure that those individuals who are working with our children are the best people for the jobs.
All right, and how you want to take us step by step on each of these kind of 3 or 4 elements that you have here, or you want to explain how we're addressing that gap, that licensure, and who is responsible?
So as it relates to so I'm going to go back to the early learning centers, which would be, I'm going to start that first,
Okay.
which will actually require that the same licensure requirements that we have now for public entities would be also the same that we would enact for privately owned facilities. And I think that's pretty cut and clear. As we found out, we didn't know that was a gap. And so now we just want to make sure that that gap is bridged. And did y'all want me to go through the bill? Because I have my notes here, but if I need to go through the bill.
However you want to do it.
Yeah. And then secondly, going back to the investigation as it relates to child-on-child caretaker, those were all kind of things that were kind of ambiguous, that were not very clear, that we tried to attempt to make clearer in terms of who would be responsible, who would actually start the investigation, who would be responsible, because what we did find, part of the testimony that we heard, especially in rural areas, they may not have the workforce necessarily to ensure that if a case is reported, that it's really followed up on. So we want to make sure, okay, if it's a case regarding this factor, who would be the person that would start? Should it be DCFS or should it be law enforcement? And we want to make sure that that was pretty clear and pretty standard across the board. But we still continue to run into some challenges with that, because some law enforcement officers are better staffed than others and do a better job, and so the system or the recommendations that were somewhat suggested may not be the best for all. So I'm going to tell you that at the end of the day, we ended up coming away with how DCFS would be actually taking the charge for most of those and going forward and clarifying what caretaker actually meant. So that is actually defined here in the statute, or what we propose
Do you know
in
what
here.
page we're on?
No, can you tell me what page we may be on for caretaker definition?
Ms. Trapp, you want to help us out?
So this starts on page 22. It's Children's Code Article 603, starts with the definition of caretaker. And some of what we're doing is there's a very specific provision in here that requires for DCFS to respond to a case. The person needs to be a caretaker that committed the abuse, and the caretaker has to provide consistent and continuing responsibility for the child. And so it was excluding individuals that live in the home with the child, but maybe they weren't feeding the child breakfast or putting the child on the school bus. And so we're expanding that to include all adults that live in the house with the child.
Thank you. Then the next big piece was dealing with the registry. Right now, early learning centers have to do a criminal background check, and check with DCFS has a central registry before hiring employees, but schools only do criminal background checks. This bill will require schools to check the DCFS central registry for all school employees and prohibit them from hiring new employees if they are not on the registry. If they are on the registry, I'm sorry. So that would be a double way of ensuring that, their background checks out by having a cross-check. And then lastly was dealing with investigations. And I was looking for the ombudsman's office because we have had a lot of conversation in some of the issues that they actually had. Oh, there she is. Ms. Ritchie, if she would come to the table.
If you will, introduce yourself for the committee.
I'm Kathleen Stewart Ritchie. I'm the State Child Ombudsman.
So if you could speak to some of the issues that I know that were kind of unclear that we try to clarify.
Well, I think that the underlying concern was that in child-on-child abuse cases, there is a need to assess the perpetrator child to determine if there are needs for that child as well, and assess the family of the child and the family of the victim to determine if there are services that family needs.
So the thought on the assessment of the perpetrating child would be that this is a learned action.
Research shows
or
that-
there's something else going on with that child as well. Is that what you're?
Research shows that children who are sexually abusive have been the victims of sexual abuse. So the concern, I think, is to determine if there is a need for services for that perpetrating child early on. And sometimes parents may not even be aware that their child has had the issues that they've had. But we want to keep children safe. Even if we would otherwise call them perpetrators, we would still need to ensure that the family is aware and able to access services for that child too.
So you're assessing both.
Both families.
Yes.
That is, I think, the underlying purpose of this statute. It's not to invade family privacy. It's not to have the agency up in the middle of a family, other than to do an assessment and make recommendations and referrals for services. So this would not be taking these children into state custody unless there's some other reason to believe that the child should be removed from the family.
And what does that assessment look like?
Well, currently the agency uses what they call the SWATM. It stands for Child Welfare Assessment and Decision Making Model. There's a tool that is used to determine if the child is safe, if there are needs for services in the home. There is also a structured decision-making model that had been developed years ago by the ABA and the National Council of Juvenile and Family Court Judges that the department has used for a long time as well. So there are assessment tools that the workers use when they are meeting with a family. There may be a different one that they're considering because from time to time they try to stay current with the field, and if there is a new assessment tool that's being considered, I'm just unaware of that. The department can answer that.
Okay.
And then lastly, the other big component that we changed was the word valid, invalid to substantiated and unsubstantiated. Because again, what we found or what we heard during our reporting was that oftentimes when a case is deemed to be invalid, then it kind of make the individual who has been the victim seem like their story was not credible or that it didn't have no validity to it, and that may not necessarily have been the case. It may have been the timing by which the investigation was done or being able to, because they were younger and sometimes not maybe seen as their story really collaborated, that it may have seemed like it was untrue, but that was not necessarily the truth. And so as a result of that, we changed the wording from valid and invalid to substantiated to unsubstantiated.
Okay. You're obviously this is a very comprehensive bill.
It is.
And I know that you've been working very hard on it.
And have worked with the department
That was going to be my question.
intensely to try to not make this more burdensome, to not overstep, as the ombudsman just stated, not overstep or create more work for them to do, but trying to ensure that our children are being kept safe. That testimony that we just heard from that family was very, it was very heart-wrenching, but it was also a testament of something that was a very glaring gap, and that's something I know that none of us would ever want to ever see. And then you guys didn't hear the whole story in terms of what they actually experienced and trying to get help. I mean, all the doors that they went to and not receiving any answers for their 3-year-old daughter until someone told them about our committee hearing. So that, to me, certainly would address that issue. But at the end of the day, as I look at some of the concessions that we have made to try to get this bill through the process, what I'm hoping doesn't happen along the way, as we just received a fiscal note, that it becomes a barrier as it relates to ensuring the safety of our children. Because at the end of the day, there were a lot more things that we wanted to ensure were a part of the bill, but we are taking baby steps to ensure that there's first coordination and then collaboration, working across these departments, making sure that they're all in sync together as we are addressing the issue for child safety in our state. But there are things that I believe already exist or should already be being done that should not require additional funding. But I take that up with the Finance Committee because I just got the fiscal note late last night.
Mm-hmm. Well, the good news is over half this committee is also on finance, apparently. So you've got a lot of advocates. Senator, to your point that you just made, so it's my understanding that DCFS is that they have these investigatory processes in place with staff, and we're really you're not, well, in a sense you're adding to it. It's the same or
Right.
very similar step-by-step process with the same folks that are assessing a victim would be also I guess in the one sense that you're adding to is the perpetrating child, right?
Right.
But it's still a very similar, consistent process as you understand it. That's already in place today.
Yes, it's my understanding, as I've been working very closely with the staff, and I want to give them a round of applause because they have been more than excellent. We have just really kind of moved a lot of things around that's already existing in current law.
Mm-hmm.
So some of these things are already supposed to be being done. And if it's going to cause the substantial amount of money, then I'm really concerned about what has been already being done because it already should have been being done, if that makes sense. That makes sense?
It does.
Okay. All right. Thank you.
Okay, we've got to.
I would like to point out that there's no data on which to project how many cases might be referred. I would certainly hope that what this couple experienced is very rare.
Yeah.
I would expect that there are not many occasions where early learning centers have allowed children to hurt other children. I do know that there are special ed advocates that are concerned about staff physically hurting children in a special ed setting, particularly nonverbal children, but even those numbers shouldn't be overwhelming. So in other words, I don't think we're doubling the department's work. I don't think we're going to have that influx of cases, but we have no way of knowing because we've not done this in the past.
Okay, we got a couple of questions here. Senator Luna, you're up first.
Thank you, Mr. Chairman. The folks that were in the video that we saw earlier, were they correct in their positions on what the law provided and this gap that they talked about?
Mm-hmm.
And was that done intentionally? Was there any reason for doing that, or was that simply an oversight or an unintended consequence?
You want me to answer that? I think DCFS traditionally is focused on child safety in the home with the caretaker. Law enforcement is typically focused on getting the bad guys, and each of those agencies have different standards. What this couple presented didn't meet either of those standards, and there is no other agency. When we discovered the licensing provisions for the early learning centers, which is what this bill is designed to address, there wasn't any oversight of the facilities, so there was no entity in the bubbles that we've created, there was no entity for oversight for that particular facility or for accountability for the harm done to that particular child, because it doesn't fit nicely into anybody's existing workload.
Well, that's a hell of an excuse, isn't it?
I mean, it's not an excuse, it's an explanation.
And I'm not aiming that at you. I'm saying it in general. We've failed this child, and we need to fix this problem. Is there any legislation, Senator, that addresses that issue currently? Do you know?
So this bill attempts to address part of that, but I'm going to tell you, Luno, if you had been there, your heart would have really been broken, because if you would have heard how many doors they went to, and it was their sheer persistency that actually got us to be aware of this gap, because I didn't know. I mean, we didn't know that this gap exists, right? And the things that they endured, and how many people they went to, how many people, and all of the excuses that they received, you would have been livid, because just think if it was our child, and if this is what people are telling us, and then at the end of the day, there was no resolution.
So they didn't fit into any category of a mandatory reporter or anything like that, especially if a teacher saw this happening?
That was part of the problem. The teacher didn't see it.
I thought they'd said the teacher did see it and stopped and told him to stop.
Well, and typically, a child perpetrating the abuse would not be considered abuse under the current definitions of the law, because it's a caretaker's abuse of a child. And clearly, another child in the same classroom wouldn't fit under what has traditionally been considered abuse.
Well, the first thing I think we need to do is we need to get this gap closed and there's absolutely no reason these schools shouldn't be treated like any other school and have the exact same set of rules, and we need to do that immediately. Thank God we have you here as ombudsman now, and it just in the short period of time you've been doing that, I've seen a lot of improvements and a lot of promise for that. So thank you for your work you do. And Senator Barrow, you've been a champion for this for a long time. So thank you as well. I'm going to ask that staff research this for some, and let's see what we can do about finding a bill that we could amend on to look at correcting this problem and getting this gap covered better, and see if that's possible. If it's not done in this legislation, then
I think we do, but y'all can clarify if I'm wrong. I think it would clarify that gap, and now that would not exist. Am I correct?
both, actually.
Yes, so in this bill, we are closing the gaps for the 250 facilities that aren't currently licensed.
Okay.
And we're also adding reporting for child-on-child sexual abuse to make it clear that that is abuse that needs to be reported.
All right, thank you. You know, when you have a 36-page bill and it cross-references literally 100 or so other statutes, It's hard to figure out what's what in it. So, and thank y'all for the work you do on this too. You know, we got to do better.
Yeah.
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 Thank you.
I agree.
Senator Boudreaux?
Thank you, Mr. Chairman. I'm not going to be repetitive. I think you asked some of the questions and concerns that I had, and then Senator Luno has just touched on. But Senator Barrow, thank you for, first of all, the task force that was put in place that allowed this family to at least have a stopping point. And Judge Ritchie, I would echo Senator Luno's comments as it relates to your engagement, involvement, and letting us know you know, what will pass the muster, how we get it done. And then to the agencies, whether it's LDH, whether it's Department of Education, DCFS, which we know they're all stretched. And I'm not going to ask them to come to the table today, but I would, Senator Barrow, like to work with you on that fiscal note with them, and maybe, because when I saw it, it was like, this is why we have problems, because we put a price tag on it and we say we can't afford it. But I don't see where there's going to be duplication. I agree with Judge Ritchie that there's going to be some out there, but you can't quantify that on a sheet of paper in a bill that's so very important. that we can revisit with Mr. Boxberger and his staff on some of these that have come up. And I know that you've received the support and the work across those agencies that I just named, DCFS, Department of Health. But if there's something out there while we're addressing this, I want to challenge the agencies to put it on the table so we get it right. We get it right. And look, again, I know, we're cutting the line on hiring and we limiting some people's pay and we're doing that. But wherever those efficiencies can impact a bill like this, and maybe some reprioritization of some of the things that we won't be able to do to move this one up. So the video was just another one of those wild moments that we have to address it. We have to do better. So I'll be glad to work with you as we continue to move this through the process. And, the awareness and the education moving forward, how do we do that? So also to the staff for when you get into that licensing, very complicated, limitations in the whole 9 yards. But, I think you and the staff have got it to a really good point. And we can see the light at the end of the tunnel that this is going to be something good. So that's it, Mr. Chairman. Of course, at the appropriate time, I would offer the motion to move this bill as amended favorably, and look forward to working with you throughout this entire process.
And I just want to add that when we started this resolution, I have been asking the ombudsman a zillion of questions as it related to investigations, while certain investigations seem like they were actually, seem to be, moving through the process of deemed as valid versus those that were not. And that's why I ended up doing the resolution. Well, what I didn't know was what was going to happen with this family and the other list of issues that came forward that we did not know about. The registry, which is not clearly like a registry like you and I may think, like you can go and just look at. It's just a way of how they keep information. That was something else that I learned through the process. So it's been very eye-opening. And as you stated, Senator, as it relates to our children, I don't think we can do enough to make sure that we are protecting them and keeping them covered. And certainly when you hear from that, like when I listen to that family, a very notable family. Dad had been fighting for our country, mother working in the healthcare arena, not being able to get answers. I was blown away. I didn't know what to even say to them. But I'm glad that we are moving forward and we are doing better. This is an attempt, I think, Senator Luna, to be doing better.
Thank you, Senator Boudreaux. And I know that we're not in finance, even though, again, most of the people on this committee are. But I want to take just a moment, and I'm sure we have some people from DCFS. Is there just one individual, and you don't even have to come to the table, but I'm going through this fiscal note, and I'm adding this up right now. You've got, this suggests DCFS reports $1.3 million to fund 12 TO positions to perform state central registry clearances. DCFS reports the need for $751,000 some change to fund 8 TO positions to refer misappropriated mandatory reports. DCFS reports the need for $2.4 million to fund 23 TO positions to collect mandatory reporter reports. DCFS reports the need for $1.4 million to fund 13 TO positions to collect and investigate reports of abuse. I would like to very gently remind the department that this bill should not be used as a vehicle to right size the department by potentially, I'm not saying we're doing this, but potentially overinflating the need for more employees to address what should be already in place with a number of employees. So again, very gentle reminder to let's continue to work with members of this committee and the author in a manner that doesn't try to take this as an opportunity to bolster their budgetary requests and overinflate their needs with staffing. That's not saying that's happening, but I'm just would urge the department to pay attention to that. All right, Senator Hodges.
Thank you, Mr. Chairman. Thank you so much, Senator Barrow, for bringing this bill. I've gotten a few phone calls and emails, quite a few today, from homeschoolers saying that they are afraid this might inadvertently affect homeschools because they are considered a non-public program. So I don't think that's the intention of the bill, but we just want to make sure that we don't inadvertently try to make them have to get a license that they don't require currently. So how can we clarify that just to make sure it doesn't? Because I don't believe that was your intention.
No, when we discussed it, that was not what we actually intended. It didn't bring in homeschoolers.
Right.
Yeah.
But they're saying that they are considered a non-public program, and under the language that this would include them. So can we just somehow clarify that to make sure it does? And I don't know if it needs an amendment or.
Senator Hauser, you want to? I think we've got somebody from the Department of Education that can maybe clarify. Not to put you on the spot, but to put you on the spot. You want to introduce yourself?
Good morning. My name is Ashley Townsend with the Louisiana Department of Education. We've been reading this as referring to those BESI-approved non-public schools. We had some clarification that we were going to seek on the non-publics not seeking. However, those are K-12 programs. Attendance isn't compulsory until the age of 5, and so we don't know why a non-public, non-seeking school would have a pre-kindergarten program in place that was officially established. So we've been reading this and working with staff in terms of the BESI-approved non-public schools.
Okay.
All right.
All right. I think that clarifies it for everyone. Thank you so much.
Thank you.
Thank you. Thank you, Senator Hodges. Senator Andrews?
Just wanted to thank Pro Tem Barrow for bringing this bill. Also would ask for a call out that she wants this passed because I'm being very optimistic. But thank you for all your work, and thank you, Judge, as well.
Thank you.
Thanks, Senator Andrews. Senator Cloud?
Thank you, Mr. Chair. Is someone here from the regarding the fiscal note from DCFS? Yeah, I know we're going to have this discussion in finance, but there is a lot of contemplation and conversations happening behind the scenes regarding fiscal notes and bills having to kind of simmer so that we get all of our ducks in a row. So I think it's just really prudent to ask this question now to not slow down the bill. So if you could come up, I'd appreciate that. I do sit on the Finance Committee.
Hi, my name's Rebecca Hook. I'm the Assistant Secretary for Child Welfare. And I did want to say that when we were completing this fiscal note, it was a bit difficult because we do not have any previous established numbers to be able to use. So we did have to use an estimate based off the calls that we had received for calls that were referred to law enforcement and a percentage that we would investigate for those calls, as well as to try to estimate some of the calls that would come in for child on child, which would be a completely new category for us to be investigating when it does take place in the school.
Well, and I think I understand that you're contemplating all the hypotheticals of what this could mean. But what I have found with other agencies in the past is that there have been some restrictions on the cross-utilization of employees within a department or an agency because they were restricted in their job description. And I don't know if that's by civil service rules or what rules apply, but we have found that there have been limits on cross-utilization of employees. And so are you contemplating, like you have a pretty big staff doing work that is in this scope, just not for this sector of children. And so have you contemplated in your fiscal note in those staff members being, their scope, their job description and duties just being broadened? And then do you have any restrictions on cross-utilization of already
So yeah, that's an
employed staff?
excellent question. We're not creating any new position types. So these would be positions that would be added throughout the state to the region to investigate the increase in calls, but there wouldn't be a specific worker that would just be assigned to these types of calls. So they would be investigating any type of child abuse that would be coming in. We were looking at the amount of calls that we thought would be accepted for investigation, and then tried to keep it consistent with what our average is, which is for one worker, they should get 10 new cases per month. And so we use those numbers in order to be able to calculate based on the new investigations that we perceived would be coming in.
So you're saying
And by broadening the definition of caretaker, we will also be getting more volume of cases that we would now be investigating that we had not previously investigated in the past. And I do just want to briefly say that I really commend Senator Barrow, because we do not want to see these children falling through the cracks either. And that was something I was able to serve on the task force with Senator Barrow. So I got to hear that testimony in real time. And I know what you saw was very powerful, but seeing them testify in person was extremely powerful. And we have really been working with Senator Barrow because we do want to make sure that there are no children that are in an unsafe home. We're very willing to try to look at that fiscal note and make any modifications that we can. But I just do want everyone to be aware, too, that we do have a little over 3,000 current backlog cases for current investigations, and we currently do not have the workforce.
And then
to
outside
investigate this.
agencies like CASA, are they able to assist in work like this with you?
For the investigation, we would definitely be wanting to talk with CASA with any types of, family involvement and advocacy, but the investigative work they would not be able to do.
It would all be official.
Yeah.
Okay. And listening to this testimony and these conversations today, do you have any thoughts that could affect the fiscal note positively?
Yes. So we actually have been looking at, especially with the clearances. One of the things when we met with LDOE, they had spoken to us about how there really is kind of a little bit of a peak in the summertime pending like new hires. And so we think we could cut some of that by hiring some like WAEs for that like temporary peak in number of clearances that we have to perform, and then would probably not need as many people. So that would probably cut at least a couple $100,000 in that area. And then depending on the number of cases, if we could get somehow a better estimate of what that would be, potentially less workers to need.
I don't know if we'll have an opportunity to get a new fiscal note just because of the backlog with the fiscal department, but maybe. But if not, I would, I know Senator Barrow is always prudent in these things, and you guys having a new financial compilation or explanation of what the bill would cost prepared for Senate Finance whenever we do meet.
Absolutely.
Yeah. That way we're not just looking at this one picture.
Yes.
Right. Okay. Thank you. Thank you, Mr. Chair.
Thank you, Senator Cloud. Rebecca, thanks for coming down to testify. Just for a couple questions, really one, and then just a comment, and I want you to kind of educate the committee on something. Talking about getting new calls because of what we're trying to do here, addressing a gap in the system. It's my understanding that you're already getting calls for this from the victim side. Is that correct?
Maybe. We are getting some calls. Some of them may be going to law enforcement and then not getting referred to us. And so or the call isn't being made. It's not being reported. Because if it's happening in a school, that call might not be coming in. And I think that's what Senator Barrow is trying to really address
you'll get
as well.
So if law enforcement is the first one notified of something, how often would you say, and this might be impossible to answer, do they not notify, or do they notify you?
I don't know that I could answer that factually, because if they don't notify, there's no way for us, like if a call comes into law enforcement and then we don't receive that notification, there's no way for us to know that call existed.
Do you have any idea of the number of child-on-child sexual abuse cases where law enforcement notifies you?
Let me just, Mona, do we? No, we do not have any way to track that, or we're not tracking that currently.
And as I appreciate it, this is child-on-child sexual abuse in the school setting.
And school, yeah, that's, I mean, even more of a narrow.
Yeah, because I do think that it's a different situation when like an older sibling
Right.
abuses a younger sibling. That is clearly a family issue, and the agency may or may not be notified.
But the bill does address both, so it would be child on child, both in the home, is my understanding of the bill, in the home and also in the school setting.
Oh, you mean in the change in the definition?
Yes, correct, yeah. So there's also some changes in caretaker as well. So just from my professional capacity, I know as a mandatory reporter, I've made some calls in the past where I've called to DCFS because I thought this is a bad case of sexual abuse. This needs to be investigated. And because it wasn't what meets the definition of a caretaker living in the home, then it did not meet criteria for DCFS to investigate. And then depending on what law enforcement agency I talked with, it may or may not have met the capacity for them to be able to investigate, or whether or not they considered it a criminal offense. And so I have seen those cases that fall, like just between the two agencies.
And I think that the intent of this is to be able to provide services to that family, because there's a problem there. Without necessarily removing a child. And a lot of times parents are concerned about calling DCFS because they think DCFS is going to come get one or both of their children. But we still need to be able to make referrals for that family to receive for the children to receive the services they need to avoid future
And I would
problems.
just caution us too to know that there's really no way for us to know what the outcome of that alternative response or investigation will be. So for us to say that we wouldn't remove, there will be instances where we will have to remove. I don't know how often that will occur, but certainly if we're investigating some of these instances, and it's good for us to know and have that awareness.
Right, and I know the agency doesn't go into any family believing that you're going to have to remove. You try to keep families together. If that doesn't work, then the state does intervene. But I think that the intent of this is to ensure that children receive what they need. Right. And if families are unable to either acknowledge or recognize what's going on, or access services, that the department be there to support the family in addressing the needs of the children and keep kids safe.
Okay. And Rebecca, you mentioned something just a little while ago. I want to make sure that the committee members and folks that are paying attention outside of this fully understand what you mean when you say you have a backlog of 3,000. Okay, can you explain what that actually means?
That's throughout the state. So those are investigations that have been open and have not been closed within that 30-day time frame. And so, 60-day time frame.
So somebody calls. Did you walk us through a typical?
So if someone were to call and say, report a physical abuse case, we accept it for investigation, then we would assign that to the region where that family lives and where that needs to be investigated. A caseworker would be assigned, and then what should happen is that they would make contact with the victim, the alleged perpetrators, and investigate the case. During that time frame of the investigation, what would be a normal standard is for us to be able to close that case within 60 days. And then also keep in mind that those cases that caseworker had, they should get 10 new cases per month or no more than that, but we know that's not the case in all of the regions of the state. And so anything that isn't closed is still on their case log. So they still have those cases that they need to close. That would add to their caseload. What we're seeing is that across the state, we are closing cases in backlog, but then new cases are entering backlog at a higher rate than the cases that we're able to close. And so some of the regions of the state have as many as 600 cases in backlog right now.
Yeah, so you're not getting a resolution on that case, and there's 3,000 of those.
Yes.
And some of those probably date back a few years.
There probably are some that date back a couple of years. There are some that probably are only, 7 to 10 days over, and then we are going to get a resolution. So, just keep in mind that we are closing some of them maybe in 65 days or in 70 days. But yes, some of them are. What can happen too is that we can have a case that's assigned to a worker. That worker could separate from the agency for some reason, and then those cases would have to be reassigned or redistributed. And so there is a delay as well, because then the new worker would potentially have to either reinvestigate depending on the reason for separation with that employee, or try to, close a case based on the information that's done, which may or may not be done sufficiently to be able to close that case in a speedy manner.
Okay. Senator Andrews, you have a question?
Yes, I do. Just a question on the note. Senator Cloud talked about, I think it was you, or your response to someone's question was you would have to investigate child-on-child sexual abuse. DCFS doesn't receive calls on that now?
No, we may receive calls, but that's not currently something that would meet the criteria for investigation for us, because we would investigate a caretaker. A child is not defined as a caretaker, and so therefore they do not meet our investigative.
So what happens
definition.
if someone calls you regarding that?
And so with the testimony that we did see, from the family that was the recorded testimony, we see that sometimes those cases are not investigated, because if a child is under the age of criminal culpability, then their law enforcement is not investigating the criminal
No, I understand. I'm
aspect
just
of it.
asking because we're being asked to add more staff positions. When you receive the calls now regarding a child-on-child, what is the process?
If there is any reason to refer to law enforcement, if there's any criminal activity, then that would be referred to law enforcement. If it's child-on-child and there is no caretaker culpability, then it is not investigated.
And that's what I'm asking. You said you don't investigate it, but who determines whether there's caretaker culpability? If you're not investigating those calls when they come through it currently, who determines whether there's caretaker culpability, which means it falls within your purview?
Yeah, that's a good question. We do have someone from centralized intake that can explain the process for when they get the call, if you would like to hear from them a little bit more in detail as to what that process would look like. But a lot of it is based on the information that we're able to obtain from the caller that reports the alleged assault or alleged abuse. And so if we are able to contact that caller, if they give us their identity, we're able to contact them and get additional information if they were to, say, make a report through the mandatory reporter portal and not call it in. But it really is the job of our centralized intake to make sure to get adequate information from that caller if they're able to give it, so that we can determine whether or not that would meet the criteria for investigation.
And Senator Barrow, your bill mandates what on child sex abuse?
It would actually mandate that it would actually be investigated.
Okay.
There would have to be an investigation.
There's some form of investigation to determine, or is it not right now currently? Some form of investigation right now to determine whether or not there's caretaker culpability? Because
No.
that's within your purview, and so that's what I'm trying to figure out. Are we just not doing that? Are we?
So that's part of that's one reason why we are trying to make sure that this is actually more clear, because it appeared that there were cases that were probably going uninvestigated, or there was not further probably review of those particular matters because it was difficult to prove. So this is definitely going to clarify that.
And I guess if the person who does this here, I do want to talk to him, because that's in your purview, and I want to know that we're doing that. We're asking for additional TOs, and I know that's in your purview, so I do want to know how those calls are handled. How are you investigating whether there is culpability of the caretaker?
Yeah, we're going to have Denise come up, and she oversees all of our centralized intake.
Let me get up.
Good morning.
Good morning. How's it going? I think you heard
okay.
my questions.
My name's Denise Evans. I'm with the Department of Children and Family Services, Child Welfare Manager 2 with centralized intake.
Yes. My question is, you receive a call on child abuse. How does the investigation go forward to determine whether or not there's caretaker culpability?
Yes, so we have three elements: a child under the age of 18, a caretaker that meets the definition per the Children's Code. And I think part of this is we're expanding the definition of that.
I'm saying prior to the expansion, because this bill hasn't passed yet currently. Mm-hmm. You receive a call that there's child-on-child sexual abuse or abuse in any way. how do you determine through central intake whether there's culpability of a caretaker, thereby triggering an investigation with your department?
As outlined by Article 610.
As practice, as what you're doing now in the practice of things.
Yes, ma'am, the legal criteria.
I understand the legal criteria. I'm asking, what are you guys doing now? If you receive a report on child abuse, what are you doing now as the intake?
Oh, okay. So there's a couple of allegations. If it's a two-parent household or a legal caretaker, or as defined by law, a caretaker, we look often at if it's child on child, like a supervision. Okay, was the parent aware that it was child on child, and did they take any action to make sure this didn't continue to happen? Were they already aware and it continued to happen, they took no action? That's passive sexual abuse. So we looked at the action or inaction failure of a parent to provide for the needs of both children, whether it was the child who was perpetrating or the victim, between child on child, and if they were both being protected and services provided, that sort of thing. What action did they take once they found out?
So on every call that comes through on child sexual abuse, there's some sort of investigation that takes place within your department?
Well, our piece, centralized intake, is we make the determination based on the law whether or not it meets criteria for an investigation.
So the answer would be no, there is not an investigation. There are questions that were asked by centralized intake to determine whether or not it meets criteria for investigation.
And this is where I'm having, because I understand the legal requirement, and Mr. Chairman, I'm going to let it go out to this, but this is the confusing part. So we just ask questions. And questions are sufficient enough to determine whether a parent is culpable?
Yes.
How?
We get the circumstances. Okay, so a reporter, let's say Dr. Hook calls in as a reporter, okay? They have concerns about information they've received of the child touching a child in the home, okay? So we ask the circumstances around that, what was disclosed to them. Let's say a child disclosed to them. Ask the circumstances. Ask if the child was aware. They may or may not know that. Just things around that circumstance. And if a child says, I never told my parents, and there's not a reasonable way the parent would have known.
But you're speaking to, let's say a mandatory reporter reports it.
Uh-huh.
Are the questions asked to the mandatory reporter?
Yes.
But are they ever asked to the child?
No.
We don't ask the child. We only speak to reporters, and we gather their information.
And so my question is, and I'll end with this, how do you know if you never talk to the child? If it's a teacher that the child complains to, you receive the call, the teacher says the child says another child at home is harming them. The teacher doesn't know whether the parent, has been passive on reporting this. It's almost like we're still in a gap on what your legal duty is, but then we're being asked for more TOs to fulfill something that should already be happening in part.
I don't know that what we're talking about now should technically already be happening, because I think we've identified that there was a gap in the law. Like, there's a gap in the law of what we can and cannot investigate. And so we are investigating what we can legally by law.
But you can investigate right now a parent participating
Correct.
Yes.
are being not being diligent in reporting. So that's something
That
you
is
can
correct,
investigate.
yes.
I believe the gap that, the law says that. The gap is that we're asking a mandatory reporter who doesn't live in the home. We haven't gone further at all to see if the parent is culpable, if they participated. I see that as a gap of what the current law requires you to investigate.
I don't think we have a disagreement there. Like, I think that we are in agreement with what you're saying, and we have been in agreement with, what Senator Barrow is also trying to accomplish with this bill, that we see that there are issues and that children are falling through, the cracks at this point, which we do not want to continue.
But not just falling through the cracks with her bill, falling through the cracks with current law and what you are obligated to. And so I think some form of an investigation should have been happening to see if the parent was culpable. Make sense? Like, that's what I'm missing. And that's already funded. No more further questions, Mr. Chair.
Okay. Thank you, Senator Andrews. Obviously, that's, as we continue to have these discussions, more and more we realize that how needed this bill is, and closing the gap seems to be the theme here. So I want to thank you for bringing the bill, Senator. Do you have anything you would like to close? We have a motion by Senator Boudreau.
I only want to say is, as we have had this lengthy discussion this morning, which I truly appreciate you guys giving so much attention to this issue, you see how much work we still have to do. And even in addressing some of the issues, there are still some things that need to be addressed. And so I am going to have a resolution to continue the study because we have not yet bridged all the gaps, but we are definitely making a huge impact with this bill, and I certainly look forward to moving it forward and look forward to each one of you helping me along the way. Thank you.
And we look forward to working with you as well. Thank you for your hard work that you've done. And I want to thank the staff, too, for
Yes.
I know that they've been working with you for months on this, so thank you.
Months.
All right, Senator Boudreau's made a motion that we report Senate Bill 41 as amended. Any objections to that motion? Seeing none, that's been reported as amended.